and welcome back to my channel. So if this is the first time you have seen one of my videos, welcome. Traditionally my channel is all about cancer and cancer treatment, being a cancer survivor, but this video is going to be slightly different. It's going to be about hair loss following surgeries, because I have had a number of surgeries that have resulted in hair loss. But before that, I'm just going to give you a quick update. I'm still here, I'm still alive. I know I haven't done a video in a long time. I've been very busy sort of living life, getting back to normal life. So there is hope after cancer for those of you that are going through treatment at the moment. You do get to a point where life does get back to normal, so trust me on that. If you are new to my channel, I was diagnosed at the age of 34 with triple negative breast cancer, which is a particularly aggressive form of breast cancer. It was stage 3 because it was right on my chest wall on my right hand side, and it was almost starting to spread. It had spread into my chest wall, so that's why I was classified as stage 3. From there, so that was August 2017, my diagnosis. I then started chemo in September 2017. I had 6 rounds of FEC-T chemo. I found out in December 2017 that I was a carrier of the BRCA genetic mutation. So what that meant, and the implications for my health meant, was that I had an 85% chance of getting breast cancer again. So another primary breast cancer. I also have a 60 to 65% chance of having ovarian cancer at some point in my life. So to reduce that risk, I have got options in terms of preventative surgeries. So I decided, instead of going for the lumpectomy that was offered originally, had I not been BRCA1, I would have gone for a lumpectomy just to remove the tumour. What I decided to do was to have a double mastectomy. So that meant taking all of my breast tissue and having a reconstructive surgery. So in March 2018, that's what I decided to do, following my chemo. So my chemo finished in January 2018, and if you watch my videos, I caught flu in January 18, which put my treatment back by, I think, 2 weeks. So I didn't have my double mastectomy until the middle of March 2018, and I had a double mastectomy with a direct implant reconstruction all in one surgery. So what that meant was they took all of my breast tissue and they put implants in. So it's a skin sparing mastectomy, skin sparing, nipple sparing mastectomy, just to give you a visual there. Cut underneath my breasts. They hollowed out all of the tissue, leaving all of the skin, and then they would put an implant in and they sewed up. And I also had lymph nodes taken out from underneath my arm. I think I had 6 lymph nodes taken out. So that was over 2 years ago now. Since then I am healthy. I have had no recurrences. I am getting checked out at the moment because I do have a lump in my neck. I don't know if you can see it, which they're a little bit concerned about, so I have got a bit of anxiety going on. So I am waiting for my CT scan appointment to come through, and that's been put through as an urgent referral. However, the doctor is quite optimistic that it's nothing, so I will keep you updated on that one, don't worry. And I'm feeling quite confident that it's nothing. Since then, so in the last 2 years, I have had another 4 surgeries. So I have done videos for those. I've had 4 what are known as fat grafting or lipomodelling surgeries. So the reason for this was because I'm quite slim up top. I carry all my weight in my lower half. I'm a pear shape. So when they put the implants in, it was very noticeable. It had a very noticeable ridge in my cleavage, and they needed the fat just to sort of pad it out and make it look a lot more natural. So I had to have 4 fat grafting surgeries. So I had my first one in December 2018, which I have done a video for, and it was quite traumatic for my body. Some of the fat was frozen, however, because I was really skinny at that point, they weren't able to get nearly enough. So I had to have another one of those surgeries, which is the liposuction and the injection. So I had that in June 2019. 2019, in June 2019, I had another one of those, and they managed to freeze quite a bit of fat in that surgery, so that was great. I then had another surgery in the October 2019 where they just injected over my implants. And then my surgeon wanted one more fat grafting surgery, but because we had no fat frozen, we'd used it all, we needed another whole big surgery, doing the liposuction on my thighs and injecting it straight over my implants. So I had 3 fairly big surgeries in the space of 6 months, which I thought my body was fine for, and seemed to cope quite well. The bruising wasn't too bad, and I seemed to sort of bounce back mentally and physically. I was a little bit tired, I was a little bit sore, but I seemed to bounce back quite quickly. However, what I didn't realise was putting my body through that much stress in such a short space of time meant that my body was kind of relocating a lot of the nutrients needed. So what happened was, in February of this year, so February 2020, I had a huge amount of hair loss in quite a short space of time. I actually went to the doctors in December, just after my surgery, and I said, look, I'm very, very tired. They did do a blood test, so I would recommend, I'm no hair loss expert at all, I'm just telling my story, but I would recommend, if you have got hair loss all of a sudden, to go and get a blood test, because what my blood test showed was that I was really quite severely deficient in B12, the vitamin B12. So the doctors couldn't give any reasoning for that. They thought it might potentially have been a hangover from my chemo. It might just be that my body just doesn't absorb B12 properly. I might have always been B12 deficient. I was quite severely B12 deficient, to the point where I wasn't allowed to just have tablets. I had to have 6 injections of B12 in the space of 2 weeks. So this was just after my surgery. And I now have to, for the rest of my life, have a B12 injection every 3 months. So I think that did make a difference. I did go and see a hair loss expert in March. So my hair loss sort of started at the end of January, sort of mid-January, beginning of February, and it was quite severe quite quickly. So what I found was I had a bald patch. You probably can't see it now because it's kind of grown back, but there was a big sort of tennis ball shaped bald patch here, and I did lose a lot here along the top, and especially here at the back. I will put some pictures up here for you to have a quick look. It was rapid, and it was quite severe, and it still is to an extent now. You can see here I've got some recession here. With Telogen effluvium, the hair loss is quite sudden. It's usually because of a trauma or stress on the body. A traumatic event can set it off, and it tends to be through the scalp area here, which is why I kind of got a big patch here, and my scalp, my hairline here, my parting sort of widened quite quickly. And it was all because of the surgeries. I had 3 surgeries in 6 months. So I did go and see a hair loss expert not far from where I live. He said that I did have some hair loss. It's difficult because he was a private practitioner, so I kind of took what he said with a pinch of salt. He did recommend light therapy, I think it was, but it was going to cost me £2,000. So for me, that was something that I couldn't justify with saving for a house deposit, and that is a lot of money. So I looked at natural ways that I could try and treat myself, basically. So the things that I found useful and that I think have worked to an extent, we are still in the early days of getting my hair to grow back. You will notice the bald spot that I had here, it's around here somewhere, it's no longer there. There is some hair loss. You can kind of see it's a bit patchy in places. You can see I've got sort of receding hairline here a little bit, and my parting is wider than I would like it to be. There's definitely a loss of volume here. I lost all of my hair to chemo 2 years ago, and so this is, for me, not as traumatic as that. However, it is still, especially for women, it's embarrassing and it is quite traumatic. 3 things that I have tried that I find work. So the first thing is trying to cover it up. I use something called Topic, which is hair fibres, and I found that really, really useful just for helping my confidence on a day-to-day basis. So if I'm going out, I will just use a few hair fibres kind of here. Topic is the best one that I've found. I do also use dry shampoo, which helps too. My cat always guest stars in my videos, so sorry about that. She can't be on her own. Come on, sit down. So sorry about the wagging tail in the background. So I have found that dry shampoo just helps to thicken this up. So I have got a little bit of dry shampoo in my hair now. So it just thickens it up, volumizes the roots a little bit and makes it look less like you have sort of thinning hair. I then use the Topic hair fibres to kind of fill in these gaps here. You can see I haven't used it today for this video. You can see kind of from this side and then compare this side. You can see I've got quite a bit of loss here. So I found that Topic really helps to kind of cover up those the hairline and the parting here, and especially at the back here I've got kind of a little bit of a bald spot here at the back, which I'll try and take a photo of for you. So I just use Topic in those areas just to sort of disguise it really. The other thing that I found really, really useful and has worked for me is taking hair specific vitamins. Now I started taking these after chemo when my hair was growing back, but once it grew back I just kind of stopped taking them, which may or may not have been a good idea. So taking vitamins has been probably one of the biggest things that's made a big difference. I started taking them about 2 months ago. It does take a while to sort of kickstart. I found the last couple of weeks I've really noticed there's sort of definite thickness in my hair has started to grow back a little bit. And I've just noticed it being, it just feels a little bit thicker than it was at the roots a little bit. So that has definitely helped, taking vitamins. I can't remember, I will link it below. I can't remember the brand that I use. So that has made a big difference for me. The other thing that I've been using is Nioxin. Now Nioxin is specifically for hair thinning. I did use it after chemo to help my hair grow back quicker. My hairdresser at the time recommended it, and again, because it's expensive, I stopped using it, as you do. So I have bought some of that. I'm in the early days of using that again. Again, I have noticed a difference. The thing that I've noticed with Nioxin, I have read up on it, it doesn't actually help with regrowth necessarily. It's a bit of a grey area. It alludes to the fact that it helps with regrowth, but actually when you look into the active ingredients, there is nothing that really helps regrowth. What it does, it layers the hair with sort of fat. So it makes your hair follicles, at the roots especially, appear thicker and kind of look more volumized. So it makes your hair look thicker. So you can see here my hair at the bottom is quite thick looking. If I hadn't been using Nioxin, it probably wouldn't be. So that's all the 3 bits of advice that I would give you if you are suffering from hair loss: is get your vitamins, get a blood test to check your vitamin levels for deficiencies. Have a look at vitamins, vitamin supplements specifically for hair growth, and maybe look into Nioxin. Now I'm using I think there's 4 different types. I'm using the one for non-coloured progressive hair loss. I use the Revlon one-step hair volumizer. I'm not being paid for any of these recommendations. These are just things that I've found through trial and error that work. So it's kind of like a hot tool. It's like a hot brush, a circular brush that you just brush through your hair, so it gives me this nice kind of like healthy looking hair. So you can see my hair is quite shiny, because I haven't coloured it since it grew back after chemo, because I used to colour my hair a lot and it just used to, well, it was just falling out, to be honest. It was a good job I did have chemo to get rid of my hair, because now it's really, really healthy. So I find it just gives a bit of style to my hair. It means that I'm not putting excessive heat on it for a long time. I'm not having to use straightener. So all of that, I think, helps with the condition of your hair, and sort of maybe prevents, in my mind, might prevent some of like the hair loss that comes with it. So that in a nutshell is kind of all the things that I'm doing to help with my female hair loss. I will try and post an update for my hair. I am thinking about getting extensions in the next few weeks. However, I did go and see a hairdresser in March, thinking that I could get hair extensions to cover up the sort of the hair loss, and it was a flat no, because the hair loss would put more, the extensions would have put more stress on my hair and probably resulted in bigger bald spots. So I needed to make sure that my hair was growing back before I got to that point. So watch this space. If I do get extensions, I will probably put an update video just to justify the expense of having them put in. But for those of you that are trying to grow your hair back after chemo, I am 2.5 years in. I've had nothing but just sort of quick, gentle trims, and this is how much my hair has grown. You can see from my last video, I think my last video it was up here, so it has grown sort of that much in about 6 months. So I am really happy with my hair growth. It's just the thickness and the areas where I'm losing it that I'm not quite so happy. So thank you for watching. If you are new to my channel, please subscribe. If you want to, if you've liked this video, just pop a like for me, and I hope to do another video soon. Thanks, bye.